A transverse incision is placed in the cervical crease, which is joined in the midline by a vertical incision, and the width of the flap is established by the pinch test to facilitate primary closure. The flap harvesting begins by placing a vertical incision in the midline. The incision is deepened through the skin and subcutaneous tissue. The next step is to identify the ipsilateral infrahyoid muscles. One must be careful to identify the anterior jugular vein which comes in the way during this dissection. This can be either identified and preserved, else it can be transected and ligated. The next step is to place the lateral incision, which is along the anterior border of the sternocleidomastoid muscle. The structures encountered during this dissection are the external jugular vein and greater auricular nerve. The dissection continues along the entire length of the infrahyoid muscles. During this dissection, one must be careful to stay above the isthmus and the ipsilateral lobe of the thyroid gland. Any small vessels can be cauterized or ligated. The dissection along the anterior border of the sternocleidomastoid continues. Any small perforators entering into the muscle should be identified and ligated. The dissection is deepened till the internal jugular vein is identified. Once the lower border of the infrahyoid muscles are identified, the next step is to cut the muscle inferiorly and start raising it along with the overlying skin. It is a good practice to suture the muscle with the skin so that there should not be any shearing injury to the perforators. At the junction of level 3 and 4, the omohyoid muscle is identified. The next step is to cut the muscle and raise it along with the flap. Superiorly, the incision is placed through the skin, subcutaneous tissue, and platysma muscle. The dissection continues till the infrahyoid muscle attachments are reached. Careful dissection is performed using bipolar electrocautery along the superior attachment of the infrahyoid muscles at the level of the hyoid bone. Meticulous dissection is performed along the anterior border of the sternocleidomastoid muscle in an attempt to identify the superior thyroid artery, which is the main feeding vessel to the infrahyoid flap. At this point, posterior branch of the superior thyroid artery is identified and clipped. The dissection continues in a relatively breathless plane beneath the strap muscles and above the thyroid gland superiorly. The distal end of the skin component is cut to ensure that the margins are adequately perfused. The infrahead flap is now ready to be transferred to the defect.